All right, everyone. Are you settled in and ready to go? I hope so, because off we go. Welcome back again to Fridays in May. This is our second in our series of 4. My name is Ann Glora, and I am joined today by a host of colleagues from Boston's Aging Services Access Points. And that's our focus today. There are 3 ASAPs in Boston: Ethos, Boston Senior Home Care, Central Boston Elder Services, and you will hear from all of us today. If you live in a different community, please stay tuned. You're going to hear lots of good information that also applies to you, but you can go to mass.gov and type ASAPs into the search bar to get your local aging services access point in the state of Massachusetts. So you'll be able to find out which organization does similar things that we do in your community. So let's get started. Our first speaker is Ray Santos. He's the Chief Development and Community Relations Officer here at Ethos. Ray develops our marketing and media strategies, our community outreach and education, and our friend in fundraising. Basically, he just keeps us heading in the right direction. So Ray, take it away.
Thanks so much, Anne, and welcome to everyone, and thank you for joining us for Fridays in May. I'm going to just give you a brief overview of a few items. Won't speak too long because we have some great content from our guests today. I'm going to share my screen and share a few slides. These will be available after the event for everyone to view. So, just a little bit about Ethos. Ethos was Boston's first neighborhood-based nonprofit devoted solely to keeping elders at home for as long as possible without the need for institutional care. We were followed very, very closely by our sister agencies, Boston Senior Home Care and Central Boston Elder Services. We all kind of started around the same time. We were founded in 1973 with one little Meals on Wheels site and congregate meal site. And today we have 150 employees, $137 million annual budget. We have 500 volunteers. And as Ann said, we're a state designated aging services access point. We're actually the smallest of the 3 of our sister agencies. Just a few upcoming events, be sure to tune in next week and on May 28th for the next 2 in our Fridays in May series. Next week we'll be having Boston, a great place to age, and it'll be an overview of those services that are available from the city and the city's Age Strong Commission and related programs. That's going to be a really great presentation. I think we have Commissioner Shea from Age Strong Commission for that event. And then on May 28th, we're going to cap off this series with a fun event, Aging in Boston, Live Healthy, Be Social, Stay Active. And it's it'll be a celebration of our National Older Americans Month, and we'll have some entertainment and a lot of really great information as well. So what is an ASAP? ASAP is a state designation, Aging Services Access Point, and we're designed to be one-stop shops for older adults, caregivers, loved ones who are looking for information and support services so that seniors can remain in their own homes. We're all community-based nonprofits, and we are all required to have a majority of elders on our boards of directors. So we serve the community, the older adult community, but we're also overseen by the older adult community. We're independent care managers with very few exceptions. We don't provide direct care. So we bring in a network or an ecosystem, if you will, of service providers that are accountable to us and perform the services in the home for older adults. We're non-duplicative, so we don't overlap, with some exceptions in some programs, and this is part of the reason why we want to talk today, because there are some programs in Boston where we sort of share responsibilities. and have other organizations sort of manage those programs for the entire sort of region. And we're all funded and regulated primarily by the state. And we have very, very strict guidelines that we have to go by. And that's why the level of care that we are able to provide with our network of providers is so high. There are 25 different ASAPs around Massachusetts. We all provide information on referral, case management. We intake, assess, and develop plans of care for older adults. We continually monitor those care plans. We reassess those care plans as needed. And we also, investigate cases of abuse or self-neglect or neglect of elders, which you'll hear about a little bit later on today. You'll see that that's information for our sister agencies, Boston Senior Home Care, Central Boston Elder Services. We'll have all these links in the materials after the event, so don't worry about looking everything up. With that, I'm going to turn it over to my esteemed colleague, Sue TENA. She's the Director of Home Care here at Ethos. Sue's been here for about 15 years. She's a licensed social worker. She began her career here, from right in the trenches as a case manager. So she really understands the state home care system very, really well. She oversees the large department of case managers, and it's just a great resource for older adults. And I'll turn it over to Sue.
Thank you, Ray, and good morning, everyone. I am really glad to be with you this morning. I love having any opportunity I can get to talk about home care. As Ray said, I started here quite a while back in 2003, actually, as a case manager, and sort of worked my way through various positions, went to social work school at the same time, and here we are today. I'm still at Ethos, and I still really enjoy the work that I do. I especially love the client population that we work with, older adults. Ethos Home Care Program serves Southwest Boston, but my colleagues here from Central Boston and Boston Senior, their agencies serve the other areas of the city. And I'm going to talk about the home care program at Ethos, but much of what I'm going to talk about applies to the other two agencies as well. And I'll invite them to chime in if they want to add anything regarding home care later in the presentation. So home care is a state-funded program, and it helps people who are 60 and older to stay independent, living in their homes. Ethos is a nonprofit, we're mission-driven, and in home care, our goal is really to give people the choice to stay home if that's what they want, rather than having to go to an institution. We try and give them choice and dignity as they age at home. The services I'll talk a little bit more about later. But for example, we can provide homemaking for cleaning, laundry, shopping. We have laundry pickup and delivery, grocery delivery. We assist with bathing and dressing. I'm going to get into this a little bit more later on in the presentation. Next slide, Ray. Okay, I'd like to talk about eligibility. So maybe you yourself are thinking about whether you qualify for services, or maybe you have someone in your family or in your community who you think could use a little bit of help. So in order to be eligible for the home care program, the person needs to be at least 60 years old or older. There is an exception if someone is under 60 and has a diagnosis of dementia. There is a residency requirement, so you need to be living at home in Massachusetts and not in an institutional facility or assisted living. So you might live in a private home or an apartment, something like that, but not in a facility. And for Ethos, as I said, we serve Southwest Boston. So that is West Roxbury, Roslindale, Hyde Park, and then parts of Jamaica Plain and Mattapan. And as I said, my two sister agencies on this call serve the other areas of Boston. So in addition to the age and residency requirement for eligibility, we also look at clinical eligibility. And when I say clinical eligibility, I'm not necessarily talking about what illnesses someone might have, their diagnoses. What I'm talking about is how do they function in their daily lives? How do they get their daily tasks done? So, for example, we look at something called activities of daily living. These have to do with how we care for our bodies. So, how do we bathe or dress ourselves? How do we do with getting on and off the toilet? Managing our bladder and bowels, getting up and down from a chair, moving around in our homes. Those are what we call the ADLs, the activities of daily living. And then we also look at instrumental activities of daily living, the IADLs, and these are more about how we exist in our environments. So for example, how do we prepare meals in our home? How do we get out to get our groceries or have them delivered? How do we get our laundry done, manage our finances, clean our homes? What do we do for transportation? How are we doing using the telephone, getting around outside, that sort of thing. And so when we assess for clinical eligibility, we're really looking at, does this individual have the ability to do all of these activities independently and safely without the help of another person? Or are there some areas of daily functioning for which they really need a little bit of assistance or maybe significant assistance from another person? So that's how we look at clinical eligibility. Next slide. Okay, then we also look at financial eligibility. And technically, there's really no income limit for our home care programs. Our target generally is lower and middle income folks, people who might need subsidized elder services, but technically there's actually no cutoff. What is true is that some consumers may have a copayment for services, which is based on their income. So the copayment may be anywhere from 0 to 100% of the cost of service. And again, you know, if they don't have a lot of financial resources, maybe it's 0 or a very low copay. If they have significant financial resources, they may be paying the full cost. What we also offer is case management, and there's no cost for that for consumers at any income level. So for the consumers who maybe have more financial resources and have those higher copays, maybe even 100% copay, you might wonder, well then, why bother? I could just go purchase services myself. And the reason is for the case management, to have that one person who's kind of organizing the services and mediating if there's issues with the services and things like that. If a consumer or a potential consumer comes to us and they're assessed a copayment based on their income and they actually can't afford it, we do have an internal mechanism where we can take a look at that and adjust copayments down or even sometimes waive them completely, depending on financial hardship, because we know that living in the city of Boston, our cost of living is very high, especially compared to other areas of the state. And we know that if you're an elder living in Boston and maybe you still have a mortgage and you have medical bills and things like that, even if your income is higher on the copayment scale, it doesn't necessarily mean it's easy for you to afford things. So I do want to say that although we look at financial eligibility, if anyone on this call is thinking, oh, well, then this isn't for me or this isn't for my loved one, I encourage you not to assume that and to have a conversation with us because it may still be a fit for you. Next slide. Okay, so then how does this work? So basically, anyone can make a referral for home care services. It could be the older adult themselves or a friend or family member, a doctor, a visiting nurse, a church member, anybody literally can make the referral. And what would happen next? So most of the referrals go through Boston Elder Info. Each of the agencies on this call also has a website where you can connect that way as well. But Boston Elder Info is a hotline that serves all 3 ASAPs in Boston. So you would just call that number, which we're going to provide, and you would make the referral. They will collect information such as the elder's name, date of birth, where they live, and then whatever other information they can get from you or from the referral source. So maybe medical information, emergency contact information, anything you're able to provide. They then alert the ASAP that covers that person's home address because we're by geography. They alert us that we have a referral waiting. And then staff within the home care program will reach out to that elder or their emergency contact to discuss scheduling an intake. So right now, during the pandemic, things have been a little bit different in terms of our operations, and some of our assessments have been by phone. Sometimes the assessment is by Zoom, if the elder is able to do that. Sometimes the assessment has both a phone or Zoom component and a brief home visit to kind of actually see the person and the home environment. So it sort of depends on the situation and what that older adult may need. But in any case, we have to do an assessment to start the case. And so what that looks like is an intake specialist or perhaps a case manager would come and assess the elder. So we will gather information about their emergency contacts, their support people, who's in their life, who's helping with anything, their medical history, any hospitalizations, which doctors and specialists they see, their medications, things like that, just to get an understanding of their health and how they're doing physically. We will ask those questions that I mentioned earlier about the activities of daily living. You know, how are they doing with preparing meals? How are they doing with bathing? Things like that. We will also ask about their income to determine if they have a copayment. During this interview, we really try and get to know a little bit about that older adult and what services they're comfortable with trying and what they need. And also, what are their unmet needs? You know, they may have people in their life who are willing and able to help them and are helping them, but maybe can't help them in all the ways that they need. We also are looking during our assessment for some red flags. You know, if it seems like this older adult maybe has someone in their life who is not involved in a positive way, maybe is abusing them or neglecting them or things like that, we look for that because we are mandated reporters and we do report to Adult Protective Services, which you'll hear about more in a few minutes. When we are able to see the home, we also assess the home environment for safety issues. So we would want to notice, for example, if there were broken steps or tripping hazards, blocked exits. We would want to notice if there was no heat or problems with, you know, plumbing, there's a non-functional bathroom, something like that. So we really look at the home environment physically and then the care environment, as I said, who's involved, family members, also formal supports too, like do they have a visiting nurse agency? Do they go to a dialysis program? Do they go to an adult day health? Who knows this older adult who may end up needing to be involved in care coordination? So that first assessment is pretty in-depth. Ultimately, the older adult has the right to self-determination, and so they will decide during or based on that assessment which services they would like to try. And then the worker, the intake specialist or case manager, comes back to the agency and we have an interdisciplinary care plan meeting with a nurse and we review the case, and that is when the older adult would get approved for services. Once they get approved for services, they will be assigned an ongoing case manager, and that's really their person who they can call at any time. If they want to change their services, they want to stop the services, they're not required, so they can change their mind at any time. Maybe they need to add some services. Maybe something isn't really going that well. Maybe they're not really getting along with their homemaker or something like that. So the case manager is the person that they would call. So at that point, they have their ongoing case manager, and the case manager will do reassessments on a regular basis, depending on the needs and eligibility of the consumer, because at this point, they're considered a consumer of services. The case manager will either see them every 6 months or every 3 months or maybe every 2 months, just to check in and see how they're doing, see what has changed, and see if their care plan needs to be adjusted. I do want to mention that the case managers, in addition to doing assessments and managing services, making referrals for services and making sure, monitoring the services to make sure they're going well, They also do other things also. So they will do information and referral about other needs. So maybe the person needs SNAP benefits. SNAP is what used to be called food stamps. Maybe they need fuel assistance or a referral to veteran services. Maybe they're working on getting onto Mass Health and they need some guidance on that. So the case manager is the one who's really going to try and answer those questions and refer them to other community partner agencies who can assist further in those sort of more specialized areas. So that's how the referral process and the assessment process happens. That's how people become consumers in the home care program. Next slide, Ray. Oh, okay. Let me see if I wanted to add anything to what I already stated. I do want to add that in terms of the financial eligibility, related to that, people often ask about insurance. Do I need to have insurance to be a home care consumer? And the answer to that is no. We don't bill Medicare and we don't bill private insurances. And if the person doesn't have insurance or even doesn't have a social security number, they can still come to home care. They are welcome to receive services from us. I promised you a little bit earlier that I would talk more about the services, so let me not forget to do that. So we have home delivered meals, and actually Ethos delivers meals to the whole city of Boston. And what's nice about the meals service is that we have a menu of different offerings. So we have some ethnic meals, so like a Latino and Russian and various meals like that. We have a vegetarian meal option. We can provide, Lactaid for someone who is lactose intolerant, and we have Ensure and Glucerna and all sorts of things. And what's nice about the meals too is it's a safety check program. So if the driver goes to deliver a meal and the older adult, the consumer, does not answer the door, we call them, and we might call their emergency contacts and other folks to track them down and just make sure they're okay that day. So it's a great safety check service. The homemaking I mentioned is for cleaning, laundry, shopping, and meal prep. I mentioned we have laundry pickup and delivery. We also have grocery delivery where you can order your groceries by phone. We can send a home health aide to assist with the ADLs that I mentioned, mostly like bathing, dressing, toileting, transferring, things like that. We have something called a lifeline. Many of you have probably heard of it. It's the button you press if you fall down and you can't get up, or have any other sort of emergency and cannot reach the telephone. And we have a lot of different types of lifelines these days. We have the kind that's attached to a landline. We have cellular, we have mobile. So there's all sorts of options for that. Some of our consumers attend an adult day health program where they go for programming during the day, and there's a nurse and a social worker there, and activities and opportunities for supervision and socialization. Particularly, this is helpful for our older adults who maybe have memory impairments or are depressed or isolated, things like that, where it's really good for them to be around people. So that's the adult day health program. We do offer some transportation. We offer Alzheimer's coaching, which is for the caregivers to kind of help them understand how to best support their loved one who has dementia. We provide medical equipment, so durable medical equipment. And we also have an option called consumer-directed care. So most of the services that I mentioned so far, we're actually contracting out to other provider agencies. We're not providing them directly. Consumer-directed care is a little bit different because the consumer can use their funds within their home care eligibility to hire someone they know to provide their care for them. So that's a really great option too. I do want to mention that these services obviously are helpful to the older adult themselves, but they're also really helpful many times to the caregivers, because a caregiver may be coming in and doing all sorts of things for their loved one and feeling really run down and stressed. And maybe that caregiver has another job or 2 jobs or 5 kids or whatever it is. Maybe they're in school. And so having us come in and provide these services can provide them a break and can free them up to actually spend time with their loved one, not doing tasks for them. So sometimes it is really beneficial for the caregivers as much as for the older adult themselves. I might be running out of time, but I want to say a few more things, if that's okay, Ray. So I want to mention that within the home care program, there are different levels of care, you know, depending on what the person needs and what they qualify for. And so it's really a range in terms of what our consumers receive. We have that extensive menu of services, but not every consumer receives every service. Not every consumer needs every service. And so just want to give you an example. We may have someone who's very frail and maybe even bedbound, and they may receive services from us all day long and into the nighttime. They may receive all sorts of services from us. And then we have other consumers, many other consumers, and more commonly, I would say, that just receive a little bit of help. So these are older adults who are still active, involved maybe in their communities and things like that. But because of arthritis or diabetes or something like that, it's a little bit difficult now to do some of their tasks. Maybe the grocery shopping is just, it's too draining. Or maybe when they cook, maybe they use oxygen because they have emphysema or something. And so when they cook, that's a problem. It's hard for them to stand there and to prepare their food. Maybe with the laundry, they can put it in the washer, but they can't put it in the dryer because once the clothes are wet, they're heavy, right? And so a lot of our consumers, they just need a little bit of help to help them stay independent and safe in the community. And so we welcome that too. And a lot of times those folks come into the program just needing a little bit of help, and we stay with them for many years. Eventually, as they age, maybe they need some more help down the road, and we add some more services as we go. We bump up their level of care and things like that. But it's really a range in terms of what our consumers receive. Lastly, I want to mention that we do have many staff who are bilingual, and so we strive to provide services in the consumer's primary language. We have a lot of consumers who are Spanish speaking, Haitian Creole speaking, we have Russian and a bunch of other languages as well. So all of those folks, we welcome you. We're ready to serve you. We also welcome our older adults of color. We welcome our LGBT older adults. Please don't hesitate to call us. We're looking for you, and we want to work with you. And the last thing I'll say is, if you are hearing all of this and you're like, well, that sounds interesting, but I don't think I qualify, or I don't think my loved one qualifies, I would say just go ahead and call, Ethos or Boston Senior or Central Boston Elder Info. Talk to us. There's no cost to you to talk to us. There's no cost for that intake assessment that I mentioned, and there's no pressure either. I mentioned that we're a nonprofit and we're mission oriented. So if we meet with someone and they're not ready, that's totally fine. It's great that we made the connection and that person now knows that they can reach us later on down the road. So I think I might be out of time, Ray. I turn it back to you.
Thank you, Sue, so much. And thanks for all that great information. Next, we have Alicia Gomez. Alicia serves as the Chief Operating Officer for Boston Senior Home Care. She joined her agency in 2017. Alicia has extensive knowledge as a social work leader and change agent in the healthcare industry. She got her start as a case manager at Elder Services of the Merrimack Valley, and that's an agency that Ethos Age Well spends lots of time collaborating with. So great start there. She continued to pursue additional opportunities in healthcare at the Lawrence General Hospital, where she held several leadership roles. Alicia also served as the Director of Population Health Management in Conance Incorporated. Her strengths lie in her ability to identify areas of improvement within an organization and where to implement strategies for change. She maintains high standards for herself and for those that she leads, and is constantly striving to provide all the necessary tools to support an organization in this ever-changing healthcare climate of the 21st century. And all of us on this call understand that completely, Alicia. She is a licensed independent clinical social worker, holds an MSW from Salem State University and an MBA from Riviera University. So Alicia, welcome.
Thank you very much. And I hope I can top what Sue just told us about the great programs that all of us have. That was really, it was really important to talk about all of that. So what I'm going to do my best. I'm going to bring over my presentation. See if I can get this. Can Ray, can you tell me, or Ann, can anybody see this?
I can only see you right now.
Okay. I'm sorry, can you see this now?
Oh, are you sharing your screen?
Let's see.
Sometimes I go down and click the attachments and forget to click the share screen button.
Oh my goodness, okay. Well, I think I might need to have,
Oh,
did you just see?
Allison has you all set up.
Okay. All right. Allison, do you have slide 1, please?
I do.
All right, thank you. So good morning, everyone. It's a beautiful day. And I'm gonna provide you some more information about who we are at Boston Senior Home Care and how we work in collaboration with the 2 other ASAPs that are on the call today. I will provide you a different angle because I think Sue did a great job talking about very similar programs that we all share and provide to our consumers. But first, let me talk about Boston Senior Home Care as an agency. It did start in 1974, so we've been around for a little bit. And our physical building is located right between South Station and Chinatown, which I think is a lovely place to work. I love working in Boston. And so we have over 40 years experience. We have about 200 employees. And we still, like I've mentioned, or Sue mentions, we do provide similar programs, but we do have different programs, and I'll talk more about that. The service area that we provide most of our care in is the Beacon Hill, Charlestown, Chinatown, Dorchester, East Boston, Mattapan, North, South, and the West End. So those are some of the primary areas that we provide most of our care in programs, but we do reach out to other extending communities with some other programs that we have. So next slide, please. So what I want to talk about this morning is, our mission statement. And what's interesting about Boston Senior Home Care is that we do have the word senior in our title, but in fact, over the past 10 or so years, we've actually expanded our reach into younger populations. So we actually have programs where we serve children, young adults with disabilities, and of course, our mainstay, which is our older adult population. And that's really where my love for social work has come into play, is really working with our older adult population. I think it's really wonderful. Next slide, please. So I want to talk about person-centered care. I don't know if this is a term that anybody has heard, but it is used quite often in social work and in programs or agencies that provide the services that the ASAPs provide. And person-centered care is important because what we want to say is that we're not just providing you a program, but we're providing you services and resources that really match with who you are, with what you need. Whether you're an older adult, you're a family member of an older adult, you're a young adult. We're all individuals. We all have different backgrounds, different needs. And so when we really assess a situation, we want to make sure that what we're providing you is something that's really going to speak to you as an individual. So one of our programs, and if you could move to the next slide, please, is our Caregiver Solutions program. And this is really one of my loves. Caregiving obviously has been a very important topic for a long time, but especially during COVID. I think all of us, in some ways, if we hadn't been already caregiving, really started to realize our role as caregivers. Whether you're a mom of young children or you have a parent that might need you a little bit. During COVID, we really started to understand the dynamic roles that we all play in the lives of people around us. And that even could be someone that's just dear to your heart, maybe not a family member, but someone that you've taken charge of, in a sense, that you check on, a neighbor, a loved one, a friend. That still very much is part of caregiving. And so as we worked together at Boston Senior Home Care, we developed this Caregiver Solutions program because what we recognize is that there are solutions out there, and the solutions may be different depending on your person-centered needs. And so we really started looking at multi-generational caregiving situations. Myself, I'm considered the sandwich generation. I have an older adult in my home, my mother, and I also have school-aged children. My needs may be a little bit different from a wife or a husband that's caring for a spouse. There's some similarities, but there may be some differences. And so at Boston Senior Home Care, our Caregiver Solution program has really expanded in the sense that we're providing supportive counseling. We have clinical care advisors who are licensed professionals. They have master's degrees in social work and in counseling. And what we found as of recent, that a lot of our caregivers just simply want to call in and talk and say, this is really hard. Things are changing. My loved one is getting sicker, and things are becoming more challenging. What can I do? I'm conflicted. Is this something I can continue to do? Which is something a lot of caregivers are confronted with. We all want to be that person to care, but sometimes the caregiving tasks are so challenging that you need some help, and we're here for that. And so simply, calling in and just exploring with us what might work for you, that's great. We're here anytime. And actually the service is free. So that's even great. That, there's a lot of things you have to pay for out there, but this is something that you don't have to pay for. In addition to our Caregiver Solutions program, we also have our adult foster care program, which is also under Caregiver Solutions. And what's great about our adult foster care program is that we have the additional piece of having the MSW, the care advisor. So along that journey of caregiving as a caregiver in the foster care program, you're going to have bumps along the way, and you might just need that extra hand and support to help you move through. Now, the adult foster care program is a program that not just Boston Senior Home Care has, but other ASAPs do also. And then our territory for the adult foster care program we do go outside of those areas that I was speaking about. But anytime you have a question about any of these programs, Boston Elder Info is a great place to start, because we can provide you that information. We can direct you to the correct ASAP if necessary. And we can answer just about any question that you have. Next slide, please. So staying connected has really become extra important, as we've all learned from COVID. That human contact has somewhat gone away because we've had to stay in isolation, and technology is very important in staying connected. And what I'd like to show you is that we have different ways of staying connected with our consumers, mostly in the Caregiver Solution program. And as you can see here, we've been running virtual support groups. We have 2 support groups running right now, and we're ready to launch a third. We have found that the Echo Show has been very popular around with caregivers. A lot of our caregivers use the Echo Show. They can keep track of their loved one. If they're in another room, they can stay in touch. We actually have caregivers who we support that actually live on the West Coast. Their loved one that they're caring for remotely lives in Boston, but the caregiver themselves lives in California. And the Echo Show has really helped with that. We also have a birdsong tablet, which is a very important piece to our caregiver program. It's a tablet that has multiple usage. You know, there's programming, education. There's just about anything you can do on the birdsong tablet. So if you find yourself interested in that, please let us know. Contact us at BEI, and we'll tell you, give you more details about our caregiver program. But the human touch is really still most important. And as we come out of the pandemic, we are, engaging in the community when we can and where we can. And so while technology is really important and is never going to go away, we would like to tell our customers that if we have older adults that are wanting to use technology, but maybe can't afford internet or don't have the tools, or simply just need some coaching, we're here for that too. Because we do find that elders are interested in being connected virtually, but they might just need a little bit of help, and we want to be there for that. Next slide, please. So Sue started talking about the information and referral service, and that is Boston Elder Info, which is also seen as BEI. And so BEI is a call center. The phones are answered by a live person, and you can call really for any reason, whether you want more information about a program. As Sue mentioned, please, if you're hearing things about a program that you're interested, but you think, well, maybe financially I'm over income or I can't afford it, please don't let that stop you from calling. BEI can most certainly route you to who you need to talk to about specific programs, most certainly explore ways of getting you into a program, no matter where your income level falls. Massachusetts is a wonderful state. As a social worker, I have to say, working in Massachusetts has been great because we have an unlimited amount of resources. There is just so much out there. And where I find BEI very important to our customer base is that it's very hard to navigate a lot of times. What's out there? How do you get to it? How do you find it? What does this mean? How do you fill out a form? And BEI can help with all of that. We certainly have staff that can walk you through a form. They can come out to your home when it's appropriate to even help fill out a form. And so we're more than happy to help you with that. And so, anytime, if you're not sure about a program, you're not sure what service area you live in, please give us a call and we'll make those referrals to Central Boston and Ethos if you fall into those program areas. Next slide, please. I'm really not going to get into a lot of detail about our home care program. Sue did a really wonderful job explaining the ins and outs about the program. Most certainly, if there's something that you have additional questions on, you can call any one of the ASAPs here today. You can call Boston Elder Info. We can certainly provide you more information on it. So please don't hesitate. as I mentioned, we do have programs that do require or have or assess by income, but we also have many programs that are free. And we have other ways of maybe supporting you financially in, getting some services that you may be wanting or needing. So I'd like to talk about our Senior Care Options Program. This is a role that we have, and we have staff that are very educated in all the services out there, and they're able to navigate this very difficult system of how to get to a service, how to find out information. So our service, our senior care options counselors, it's free of charge. They can come to you, they can talk to you over the phone, they can help you, guide you through, the system, and help you find what's best for you and answer questions. So options counseling, that is really a part of our senior care options program. That's essentially the role of the person that would be working with you. Their title is options counseling. And as it says, options, there are a lot of options for older adults in Massachusetts. As I mentioned before, we live in a really great state, and there is just so much to take advantage of. And it's really important that, that you reach out to us and let us know that, if there's something that you have questions or you need something, we're more than happy to help with that. What I'd like to move to is the next slide regarding nutritional assistance. And Sue did touch upon this. Once again, another great resource. No one should go without food. There are a lot of options for nutritional assistance. Ethos has a wonderful meals program. We can certainly link you to Ethos and directing you in getting Meals on Wheels if meals are what you need to be delivered to the home. In addition to that, if you're needing some extra help buying groceries, the SNAP program is wonderful. Yes, there is a form you have to fill out, and sometimes that feels daunting. Maybe, there's a vision problem. You're not sure how to answer a question. Don't worry about that. We can help fill out the SNAP applications for you. We can help gather the supporting documentation. We will see the application through. We will make sure your application is submitted, and we will make sure that you get a response back from the program to your benefits. So please don't hesitate to reach out. There is plenty of options in our area to seek out a needed nutrition. So I'm going to end there. I said a lot of information, and we do, I think we may be taking questions afterwards. So please reach out to us. I will be on the call for the entirety, and we have a panel of staff that can also help answer questions. I'm not sure who's next, but I am going to pass it on to the next person. Thank you very much.
Oh, thank you, Alicia, so much for that. And if you have questions, we do have other folks from the our sister agencies joining us. So if you have a question, put it in a chat, and chances are it'll get answered pretty quickly for you. Our next presenter is Alex Lazebnik. He is from Central Boston Elder Services. Alex is a graduate of Daniel Webster University of New Hampshire. He's got a degree in business administration, and he's been working at Central Boston since 2010. He has advanced to a supervisory position in protective services, and I'm really happy he's here to talk to us about that. A lot of his prior work was in the social services field as well. So welcome, Alex. It's nice to have you with us.
Thank you, Anne. Thank you, everyone, for participating. Sue, Alicia, your presentations were very informative. I do appreciate you basically covered a lot. So I will try to summarize what Central Boston are capable to provide our participants, so to speak. Brief history. I believe our agency was founded back in 1974, right around the same time when Boston Senior Home Care. And we are also a nonprofit agency that has a multitude of programs. The list of them could be, looked up on the internet, but I can specify in order to summarize this whole thing quickly. A home care program, senior care options, One Care, Boston Allied Partners, group adult foster care, adult foster care. And one of the programs that we offered a couple of years ago, it's called Veteran Direct. It's for our veterans who participated in military combat and require assistance in the community. So as Anne have claimed, I did participate, in numerous programs when I joined Central Boston since 2010, and moved into a field which is called protective services. I've been in this field for the last 6 years, and gradually became one of the supervisors here. So what exactly is happening in our program? And let me briefly, go back. I deeply apologize. So the agency, Central Boston Elder Services Agency, is conveniently located, the way we believe, is right in the middle of city of Boston, Roxbury area. We are stationed across Dudley Station. It's a major hub for those who are willing to stop by and walk in and find out as much as they need about the programs, what they qualify for, how they can apply for certain things. They're absolutely welcome to do so. However, I must admit that at the present time, due to COVID restrictions, our agency prefers for folks actually to follow up over the phone and schedule in advance if possible. So let me share my screen quickly, and you folks will be able to see the main telephone number, which is 617-277-7416. Once you're going to get connected to the front desk, you will be promptly guided to the appropriate resources, case management department or upper management, who will be able to assist you on the questions that you might have. Going back to protective services. So protective services is one of the programs which basically covers the entire city of Boston. We cover our sister ASAP agencies, Ethos and Boston Senior Home Care catchment areas. So as you can see, the area that we control basically is highly dense and populated, so to speak. So we do have tons of referrals, and we absolutely don't mind to continue to receive them because it's absolutely appropriate for us to assist elders. So what the program is designed for. The program is basically for the elders 60 and above. And the goal is to assist those who are in great need, who were intentionally or unintentionally harmed, neglected, abused. Obviously, there are many forms of abuse out there: physical abuse, financial exploitation, sexual assault, neglect, emotional, physical, psychological abuse. And I guess the most popular, so to speak, I guess we need to mention is caregiver neglect. Obviously, as Alicia and Sue have mentioned, we do know that a number of families who are out there who might be stressful during the COVID time and with the workload, who require assistance on our end, they might be able to report to protective services, and we might be able to go out, assess the situation, and refer the elder or the family to the appropriate resource. In this case, it would be either a program or a ASAP agency who will be able to step in and guide from that point by enrolling the person or the family in the appropriate program. Let me switch a slide quickly. So I briefly touched this one. This is who we are, and this is what we basically do. The goal, as I have stated, is to assess the situation and assist the elders and their families by guiding them through the appropriate resources and connect, so to speak, with the law enforcement when the moment is right, so to speak. This is, I also briefly touched on this one. We are assisting elders who are residing in the community. Most of the time, we don't go into nursing homes unless it's required from us to assist someone who've been reported to us for financial exploitation. And we need to make sure that once the person is being discharged into the community, they have sufficient funds or have what we call being financially stable to return back home and cover those living expenses. Who can report and who probably should report to us? So anyone capable to report to us. We do have mandated reporters, as Sue have mentioned, case managers, ASAPs, nurses, social workers, law enforcement. But we also, encourage people in the community to report to us because you are basically our eyes and ears out there. You can see as much as you're able to observe out there. So anything that you might be able to report to us, we will take that information and we will process it through our team of screeners. We do have specific task force, so to speak, who are specifically go by a risk matrix, and based on the report, they determine how to process the actual report. Where you can file this whole thing. So there are two options that are being presented to you folks. Option number one, you may use a 1-800 number, which is listed right here. And I hope that you can see this. Forgive me, I didn't ask if anyone capable to see the actual PowerPoint presentation. Do you folks?
Yes.
Yes. Okay, and thank you, I appreciate it. So that's one of the options. Once you're going to connect to a centralized intake unit, they will accept your report. It could be done verbally. You can also fax the information to us via a mandated reporter form, and the fax number, which is listed here, will lead you straight to our department at Central Boston. The fax number is 617-991-9772. You can also file a report online, which is also available, I believe, for the last year. It's been quite a success. People were able to use that, and we actually encourage people to step in and file those reports via online. It's easier to track and much quicker for us to review them. I briefly want to touch base on people who work alongside with me and people who might be able to consult you in the future. As you can see, each of the supervisors, and we do have 3 supervisors on the team, is specifically allocated to one of the ASAPs out there, and each serves a liaison to answer the questions, to provide some guidance. So we do have 3 supervisors on the team. My name is at the top. I work for Central Boston staff, and we do have additional 2 workers who actually are capable to assist you over the phone if needed for you to communicate with. Their names are Fatima Rodriguez, and I deeply apologize. We're going to add this slide because recently one of the supervisors kind of left the agency, and we do have a new supervisor who will continue to work as a liaison for Boston Senior Home Care. That slide will be added. Okay. Moving along. So what are the specifics that we are looking for when you filing the report? What we're trying to do, folks, is to obtain as much information from you as possible. Any description, anything that you might be able to witness, physical appearance, home environment, anything that you have witnessed or overheard that you could actually list to us on that report could be helpful. Specifically, I would request for those who are willing to file to identify to us, because this is going to definitely speed up the process of screening, so to speak, the level of competency of the person, because we do have a capability to verify, but because the process is quite lengthy, we have to go through various resources of our own to obtain that information. If you are capable to supply us with that info, that would be greatly appreciated, because it helps us tremendously, especially for our screeners who are working on the cases. So after the report actually being filed, what are the expectations and how we actually divide this whole thing? We divide this whole thing in 4 sections. As you can see, each report has to go through a rigorous verification through our risk matrix. And once the screener actually sees that the level of risk is higher or lower, we develop a specific type code and the level of response, so to speak, for each report. So for those who are in greater need, we are assigning these cases a code for emergency and rapid, and the rest are go below that. How the process actually works. So once the case is being assigned to a worker, we conduct an investigation. A worker has to go out in the field, meet, gather as much information through the collateral resources, and then present this information for an observation to one of the supervisors, where a team will be able to assess and come up with what we call a service plan to assist a family, a caregiver, or in this case, it could be an elder. We do have a right, according to the statute of the law, to run police reports, query, obtain financial information. So we have to inform those who are listening to us right now, everything that we gather, every report that you file, every information that you submit to us, everything will remain confidential. So we are not sharing that information with anyone except for the courts. Courts do have a right to subpoena the case if it becomes necessary. As I have mentioned, capacity is the key component in our assessment, and it's absolutely valuable information that you can present to us on the report. And I do encourage, specifically for those who are case managers or nurses or even family members who are trying to submit any information to us, indicate what level of competency that person is, because it will tremendously speed up the process for us to go out, assess, and help you out by connecting to the right resources. So the last step for us to help you folks is a service planning. As it's been mentioned by Sue, who works in home care, and Alicia, who presented different types of programs at Boston Senior Home Care. We do use similar resources at Central Boston Elder Services, and if it's necessary, we do connect you folks to our sister agencies who might be able to assist you as much as we do. It just all depends on the area of service that we supply, that information to, or that information comes to us. And last slide probably will be basically like a Miranda slide, which allows you folks to understand that everything that we obtain, as I have stated prior, will remain confidential. We do respect, elders' rights. We respect, confidentiality. We will do everything as much as possible to keep the information confidential and protected. Obviously, the elders do have their own rights, and we respect that. We understand that some elders who are out there who might be reported to us feel that it would be inappropriate for protective services to step in and try to assist. We have to say that we recognize their right to say no to us, but we also must say that the statute of the law allows us to investigate the situation in the household in order to assist and in order to make sure that the risk level is low. So our goal is to give you as much freedom as possible, not to disrupt your lifestyle, but at the same time, when it comes necessary, we will try to step in to prevent further harm. Well, this is the end of my presentation. I know that I went beyond the timing that was actually scheduled for us. And if you do have questions, don't hesitate. We will, answer on those at the end. I know there is one more participant who's supposed to present the information, so I will allow Anne to step in and transfer the panel, so to speak, to my colleague. Thank you all. I appreciate it.
Thank you, Alex. Thank you so much for joining us, and Alicia and Sue as well. Ray, what do you think? How are the questions going in the chat? I haven't had a chance to take a look. Are there some that haven't been answered, or Are we good? We're not that far over, Alex, so you did just great. No worries. No worries at all.
Yeah, and I think it looks really great. I think that our presenters did a great job of answering questions as we went along, and we've had staff on in the chat answering questions in real time. I will say, you know, if you have any questions, please do not hesitate to reach out to us. Please call Boston Elder Info 617-292-6211. That's or www.elderinfo.org. That's our common referral line. You have a soft handoff between agencies when you contact that number, and oftentimes they're able to answer a lot of questions right off the top. If you live in one of our respective areas that we cover, and I know we saw a little bit about that in the chat and in the presentations, don't hesitate to reach out to us directly. You know, I think the biggest, you know, the message that we can then leave with you all is, if you have questions about anything related to senior services, don't hesitate to reach out. There's a wealth of knowledge out there with, you know, across the city of Boston, across our agencies, lots and lots of expertise. We're all, you know, working together to help seniors throughout the entire city of Boston. You know, it's a team effort for all of us, and we're here to support older adults throughout the city of Boston. Thank you so much to our presenters. Don't forget to tune into our next Friday in May event, and again on May 28th for our final celebration of National Older Americans Month. And we wish you all the best of days, and thank you so much for coming.
Thank you, everyone. Have a great weekend. We look forward to seeing you next week.